Can you picture someone who does not have a doctor or nurse practitioner? Now picture 4,000 of them. Imagine a clinic that welcomes and understands them all and gives them access to the care they really need. Visualize an umbrella of professionals who guide them to their healthiest lives, with familiar faces to greet them and build professional relationships built on trust. This clinic really does exist. It's called the St. Thomas Community Health Center, and I am proud to work here. Our job is to look after people who don't have a provider and to lighten the load on our local hospital.
I was without a doctor for about 2 years, and one day they had an open house here. So I came in, and they said, well, what would you like? I said, I haven't got a doctor. My doctor passed away. So they said, well, just hang on for a minute. And they got Laura to come over, and she took me as a patient, which has been a blessing. And I felt completely comfortable here.
Since joining CCHC, I've seen a real decrease in our clients who go to the emergency department for non-urgent reasons. We participate in community initiatives for those in crisis, and we provide outreach services to those who have no other access to care to help avoid emergency department visits and hospitalizations. When our community needs us, we are one of the first to step up to the plate and help out, and we hope that we always will be.
I'm not sure everyone always understands the extent of support CCHC provides to keep patients out of our hospital in emergency and stay safe. They play a key role in providing day-to-day health care to the most vulnerable members of our community and in a holistic and accessible manner. A primary partner with public health, CCHC also looks after people with COVID, those in an opioid crisis, and our itinerant farm workers. In addition, CCHC reaches out to Mennonite, Amish, and Indigenous communities and supports anyone facing barriers to care.
Central Community Health Center is a valuable player in the complex system of healthcare. They are an important part of what contributes to helping people achieve better health and well-being. CCHC services thousands of clients, many of whom are the most vulnerable in our communities. Public health and the CCHC, we work in tandem and often side by side. We complement one another by providing accessible and preventative health services that are equitable for the citizens of our county. The CCHC makes a difference in people's lives, in the short term and in the long term, and thereby creating a more vibrant community.
I want to share some of our thoughts with you about the St. Thomas Community Health Center and the great work that it does in our community and for our city. A provider of health care to some of our most vulnerable in the center of our community. It's been a group that's worked extremely hard with us on a crisis over the last 2 years through a pandemic. Anything we ask, they help with, whether it's general health care at our shelter or on the street, healthcare in their own center, and the cooperation with the street teams that we use in St. Thomas from a health point of view. We couldn't do it without the Central Community Health Center. We sure love doing it with the Central Community Health Center and all they can deliver for St. Thomas. Thank you.
Hi, I'm Dr. Ziada. I'm a family physician working in Central Community Health Center in St. Thomas. We provide healthcare to families and individuals through an integrated team approach that includes physicians, nurse practitioners, registered practical nurses, physiotherapists, social workers, dietitian, and chiropodist. We work together in our patients' best interests. With the current shortage of healthcare providers and the growing population in the area, we play an important role in the system. We also provide health promotions through community programs to prevent illnesses. Without Central Community Health Center, we would see families and individuals with chronic medical conditions increase the load on the hospital emergency department.
Building a healthy and safe community requires partnership, and we are very fortunate to have the Central Community Health Center here in St. Thomas, equally contributing to maintaining a healthy lifestyle for all residents. St. Thomas, like many other communities, has experienced an increase in homelessness, mental health, substance use, and poverty. We need to work together to break down the social inequalities when it comes to poverty and access to health so that everyone can receive the appropriate resources to reach their full potential. The Central Community Health Center respects and encourages diversity in our community and even within their own organization to assist with breaking down barriers so that the appropriate resources can be achieved and received by all residents in our community. I strongly support the services that are being provided by the Central Community Health Center here in St. Thomas. Thank you.
Our clients have access to all they need under one roof, traditional medical care plus much more to promote health and prevent illness in the first place. We work with the whole person by providing services such as social workers, dietitian, physiotherapy, foot care, smoking cessation, treatment and support for addiction, and more. Because we know a healthy community leads to individual health and vice versa, we make it our business to work with other agencies, business leaders, provincial governments, etc. We are St. Thomas proud, and we are Elgin proud.